Good morning. Welcome back. Today is the last day of March, March 31st. It's 11 in the morning. It's 70 degrees, headed towards 82. So welcome to Sonoma County. Gary and I are back today with some general news and more specifically issues around COVID that we think will be of use for you as you deal with your patients. Gary, I'm going to start off with just kind of some logistics that are happening to us here at Smugger. First of all, we've had, because of the supplies, we've had to contract down our vaccination stations. So we're now only performing vaccinations at the Luther Burbank Center. We've closed Stony Circle and Airway. This probably means that you've seen your staffing get a little better in the office, that people have returned back to the office. And I found out that we have actually hired 18 medical assistants dedicated to giving vaccines that are working at Luther Burbank, which is further freed up people. So hopefully your offices are lesser impacted now. Sutter Health has now joined in on the state level, utilizing the statewide phone system called My Turn. So your patients can go on My Turn to look for an appointment, and it talks about eligibility at that site. If someone does indeed choose to get their vaccine with us, what it actually does is it dumps them into our queue on My Health Online. So My Turn is just triaging to Sutter. They're not actually interfacing with My Health Online. So you should just know that patients still have the opportunity to go directly to My Health Online to book into our clinics. The tiers are about to change, the eligibility tiers. We're in the midst of vaccinating those that are 50 or under 64 that have comorbid conditions. As of tomorrow, April 1st, everybody in the state is going to be dropping that down to now include all healthy 50-year-olds and above. And by April 15, it's going to be wide open to everybody. That's not to say that we have vaccine for those people. So there's probably a lot involved in making those decisions, but it is what it is. In terms of the supply, that still is the problem. I'm told we are resuming first vaccines at Luther Burbank. We're getting about 300 vaccines. We're able to deliver about 300 shots a day. We can do up to a couple thousand, so markedly impaired. It's just the way the allocation is working. You might have seen in the PD the last few days how the Sonoma County Council is reaching out to the state and saying we need more vaccine, and it's actually a bit of a quandary. Sonoma County, for its size, is lagging behind other counties, so it's on the state level of news as why Sonoma County gets shorted. So we're hoping that plays to our favor and we can see more vaccines coming. We'd like to get it right back up, ramp up to what we were doing before.
Gary, I was going to say that it makes it really hard for patients. They just don't understand that when you drop the vaccine requirements and you make it more liberal, that doesn't mean there's more vaccine available. I think there's an implication that if we're dropping the tiers from the public's perspective, that means there's more vaccine. And there's a lot of news with the Biden administration about wanting to vaccinate so many people. But it's really hard because the providers are kind of caught in the middle because we don't have enough vaccine, but we're dropping the tiers. So that is a bit of a struggle.
Yeah. Cynical side of me says there's some politics involved here because it looks very favorable to be opening up to everybody. But I'm assured that our supply should be ramping up, albeit slowly. The J&J vaccine is out. Sutter is getting a very small supply of that. It will not be coming to Sonoma County at this point. We have a pilot site in Santa Clara, I believe, that they're going to be using J&J, so we won't be dealing with that here in Santa Rosa. So that's kind of the latest news in vaccines. We're back in the game, albeit slow, so your patients will be scheduling for first shots again. So that's the good news. So Gary, I would like to turn over to you. Let's talk about surges, because it seems quiet here, but every day you hear on the news that there are surges happening all over the world, United States. What's the current status?
So I've been worried about the third wave, and so far for Sonoma County, I think we've been doing great. But I think one of the main reasons for the surge is because we have a lot of variants circulating. So I'm going to show you a slide of the variants. This is kind of where things start. Now, there are three categories of variants. Variants of high consequence. That means that vaccines not working, medications aren't working. We don't have any of those so far. So we have not identified in the world anything of vaccine of high consequence. We are noticing variants of concern. Variants of concern includes the UK variant at B117, the South Africa variant B1351, and then in Brazil we were following the P1 variant, but now there's a P2 variant coming out of Brazil. And I'll show you some epidemiology stuff for Brazil in just a little bit. California has two variants, 1427 and 1429. And in the US, we're sequencing about 1% of the viruses. We're hoping to get to 2%. Other places like the UK, they're sequencing 10% of their viruses. So they're finding out more information. But in the US, in California, 1.1% of our variants are the UK variant. 52% are these new California variants that are 20% more contagious. That's what we know so far. So we're seeing our own variant in California, as well as some other variants from around the world. New York has its own variant as well, and that's the B1526 variant. Now there are many variants of interest, and when those variants get tested and vaccine breaks down or neutralizing antibody breaks down, or they become more contagious, or we found out they're more virulent, then we move them up to a variant of concern. So we're going to see variants come and go, but I think that that's going to be one of the leading factors if we're going to see a third wave. So
you talked about California having over 50% of our local variant, shall we say, but when we talk about Europe, it seems to be the UK variant. Is there any way you can compare those two in terms of how effective they are in infecting people or how serious they are?
Yeah, we think that the UK variant is about 30 to 40% more contagious than the prior variant that came out of Italy a long time ago. The California variants are 20%, so they're not as contagious as the UK variant. The UK variant seems to be a little bit more virulent in the elderly population. And fortunately, the elderly population is now getting much more promptly vaccinated, so they're more protected. We think that the South African variant might have more of an effect on the vaccine than the UK variant. So the California variants and the British variant, the UK variant, the vaccines are working great. The South African variant is being studied a little bit more. The AstraZeneca vaccine, which we're not using in the US, not yet at least, that hasn't stacked up as well with the South African variant. And then the Brazil variant, all bets are off. We're still studying that.
Okay.
So let me show you some epi slides. These are very interesting. The first one is the one in Italy. So this is where Italy stands. And as you can see to the arrow, Italy never really locked down the virus super well, but for a number of factors, including the variants in Italy, they're starting to see a surge of cases. The next one is Brazil. I put Brazil on the map because Brazil is one of the leading countries struggling with this. So they never really, their second surge went right into a third surge. And on the next slide is going to be the death rate in Brazil. The death rate in Brazil is really a problem. And as you can see, their death rate in the third wave is worse than their second wave. So, and Brazil's main issue is poverty, lack of infrastructure, lack of vaccination, and a really dangerous variant. So again, it's a variant of concern still, not a variant of high consequence, but it seems to be really playing havoc in Brazil. Now let's go to the US. So in the US, here's what's happening in New York. A number of areas in the US are having trouble with surges. New York, New Jersey, Florida, Michigan have seen surges of cases. And then we've seen an uptick of cases, more than 10%, in Illinois, Iowa, New Hampshire, Pennsylvania, and Vermont. So I want to show a couple of the slides. One is from New York. In New York, as you can see, New York didn't really lock down the virus, but they're starting to see an uptick of cases after their second wave. And the next slide is Michigan. This is Michigan. You can see Michigan clearly went down on their second wave, and now they're going up significantly, and they're heading into their third wave. So we're seeing pockets of a third wave in different parts of the country. And right now it's a race. It's a race to vaccinate as many people as you can, and that will tamper down a third wave as people crowd more with schools going back, spring break, Easter, Passover. This is a time when we have crowding due to a number of factors, and we need to make sure people are vaccinated enough. The good news is that we've vaccinated so many more of the elderly that they're not a vulnerable population anymore. The next slide is Sonoma County. If I showed you California's epi curve, it looks very similar to Sonoma County's epi curve, where we haven't really seen an uptick yet. Despite having these two more contagious variants in California, we're doing the right things, we're vaccinating as fast as we can, and we see a very low number of cases. So we haven't really experienced a bump in cases in California or in Sonoma County yet. And that's why we're coming down on the tiers county by county by county, which I think is really helpful.
That's the most reassuring slide you have, because it looks like really there's some time there at being low in Sonoma County. So.
Yeah, and if you look at the southern footprint, it looks really good as well.
Good.
I think we might see a bump in Sonoma County, but I think we might not see a surge if we do everything right.
So what might that bump look like then? Given that the vaccines have come out, we have some data on who's been vaccinated that might be more protected.
Right, so let me show a slide of that. So the next slide kind of shows how we stand in Sonoma County. Now, we always talked about herd immunity. We need like 50 to 70%, probably more like 70% of vaccination rates or natural immunity to develop herd immunity. And in Sonoma County, 45% of people have received at least one vaccination. Mm-hmm. So that means that 19% have only received one dose, they need a second dose, but 26% have actually been fully vaccinated. And if you look at the breakdown on this Sonoma County slide, the elderly are very well protected. So if we see a bump in cases, we're probably going to see it in younger people who hopefully will not get as ill. Yeah. So we may see a lot more outpatient illness than we would see hospital illness or ICU cases.
Okay. That being the case, when we look at, so on the flip side, the socioeconomic, the tiers that the county has, the various colored tiers, that's not so much, well, you tell me, is that based on hospitalization, ICU, is it more based on just community rates?
It's based on community rates. So it's the number of cases per 100,000 population.
Okay.
And if our number of cases go up per 100,000 population, even if they're hospitalized or not, that will take us into a higher tier.
Okay, so the vaccines are protecting the elderly population, but if we still see a lot of circulation, even among the younger population, maybe less mortality, but it could have some impact on our ability to open up again.
Yeah, it could affect our tier status.
Okay. Hey, thank you. That's helpful. It's dynamic. Every 2 weeks, it's changing. We didn't see these surges 2 weeks ago, so it's worrisome. But I'm pleased to see what's happening here in the state of California. I'm going to finish up with just a few more items of business. First thing is, it's the last day of March. We're calling it a season on the flu. The flu season was non-existent this year, and officially we're no longer going to be offering flu vaccines, so no need to pin that or have that conversation with your staff. Another thing unrelated that just came across my desk today is the managed care department, referral department specifically, is behind. They have a number of glitches going on that are numerous. You need to know that when you make a managed care referral, that requires authorization. They're about 8 days out right now. And I know that is particularly impactful in complex imaging. Radiology folks say they're getting a lot of patients, excuse me, that are disgruntled with the fact that they're having to wait. And then the last announcement I want to make is my slide here about HealthStream. And this is just to bring you up to date with where you're at. Remember, these are our assigned learning courses that are included in our PSA. And you'll see in the right column there the rationale for all these. There's actually a good reason for us to be doing these. We live in a very regulated, we work in a very regulated environment, and mismanagement in some of these areas of compliance and ethics and harassment can turn into big deals, can turn into expensive ordeals, both for the medical group and for individuals. What is literally happening tomorrow on April 1, we're releasing 2 more courses. We've been doing the harassment course, has been available to you for some time now on that external site called Trailiot. But as of tomorrow, we'll be getting an assignment about coding practices for our managed care, particularly our Medicare Advantage, our Medicare HMO population, and then some compliance highlights will come out too. So 2 more HealthStream assignments. I'll be sending you an email about these tomorrow. Again, all of these are encompassed in our PSA. These have to be finished by November 30th for us to comply with the PSA to receive the funds that would allow us to pay each and every one of us for the time that's involved in this. So, last thing I want to say is just keep up the hard work. These are trying and difficult times out there, and I know the work is hard. You know, I was just thinking the other day, I was in the office and I was sitting next to one of my peers, and I think both of us were kind of lost in the trees, and we're kind of questioning, well, why are we doing all this? This is really hard work. And we thought about it, and we thought, you know, we're in a field where we get to use our intellect, our brains. We're not using our bodies like so many patients we see, these concrete workers and construction workers. We're in a field where we get to interact with people, we form relationships with people, and we have this opportunity to encompass all that and help people with their health and help people with their lives. And it's kind of like, how cool is that? It kind of brought us out of the ground level, brought us up to a high level. So keep up the good work. Enjoy what you're doing. Thank you from us, and thank you from your community.